Hi, Cassidy.
Hi, hello, Farnas.
Thank you. Thank you very much for coming on board and for sharing your thoughts and insight on COVID-19 and informal settlements. We know that a large population of cities, of urban population, they live in informal settlements. For example, in Bangladesh, over 55%. So the question of having safer cities, having urban resilience cannot be answered without thinking about informal settlements. So here is it to you. What do you think about it?
Great. Thank you very much. Yes, I think that as we see in a lot of cities in the global south, informal settlements encompass sometimes 20% and sometimes up to 70% of the urban areas. And so when you think about the kind of risks that people are exposed to in informal settlements, it can be sometimes different than the way of people who live in cities that are developed and have access to legal buildings, infrastructure, and services, and all of those things. And so, what I wanted to talk about today was particularly thinking about vulnerability, poverty, risk, and in relation to COVID-19. And the reason I wanted to talk about this at the beginning of February this year, just as the coronavirus was sort of accelerating across the world, I heard a very interesting short as a thought of the day on BBC Radio. And the speaker said that the world's population is only as strong as its weakest link. And it really made me think about how, the things that we've been talking about for years in disaster risk management, about vulnerability, why people are vulnerable to disasters, and those people in informal settlements being vulnerable to disasters. And why we're seeing this thing around COVID-19 and its proliferation. So I want to make a couple of points in regards to this today. The first was that we need to see COVID-19 as part of a pattern of diseases that are bridging the animal to human gap. So COVID-19 is a zoonotic disease, meaning it's transferred from animals to humans. It's not the first one we've seen. We've had swine flu, SARS, HIV, Ebola. These are all zoonotic diseases. And what we've been seeing is that they're coming at a faster and faster rate. And this is because of land use changes and density of population. I was watching last night, Sir David Attenborough has a new documentary on extinction where he discusses this and showing how the human impact on the environment means that we're becoming more and more into contact with animals and intruding on wildlife habitats. In that documentary, they discuss the possibility that COVID-19 came from the rural province of Yunnan in southern China, where there are huge amounts of especially bat populations, and the intrusion into those areas of development, basically new roads, housing, agriculture, etc., has put people into contact with those animals. And people are bringing out wild animals, selling them in markets, or the virus is being passed on. And this is why we're getting these zoonotic diseases. And of course, it's not only in China, but it's all over the world, but particularly in developing countries where you have rapid land use change and people coming into contact with wild animals. So rapid demographic growth, migration and density, the increased movement of people and animals in cities, and these land use changes are linked to this sort of prevalence of zoonosis, and especially in the urban global south. There's a very nice paper in Environment and Urbanization by my colleagues at DPU, Suhail Ahmed, Julio de Villa, and Adriana Allen, where they talk about this relationship between animals and urbanization in the global south and zoonosis. And basically, they say that this issue requires urgent attentions because those structural drivers that are producing this need to develop more agricultural land, this need to constantly push into natural areas is creating risk, and not just for people living in cities, but as we see with this emergence of COVID-19 with the entire world. And I think this emerging global health challenge is deeply connected to the urbanization of poverty and inequality within cities. And as we've seen with the coronavirus, the overwhelming impacts of this virus, although it affects everybody, it affects more the poor. And this is because of disparities. We could see, for example, in the UK, the Office for National Statistics reported in early May 2020 that the most deprived areas in England and Wales have 55 deaths per 100,000 people, compared with 25 deaths in affluent areas. And people working in lower paid jobs are more likely to be exposed due to the need to be at work, the need to travel to work, the need to use public transport. And also in the UK, Black and minority ethnic groups are 2.5 times more likely than white people to die of COVID-19. And this could be related to higher levels of deprivation, but also the types of employment that people have as frontline or key workers. And this sort of statistics, which are very good for the UK, also transfer over to a lot of situations in countries of the global south. For example, people, we see in India, for example, what happened with the lockdown in India, where migrant workers who work on daily wages, as soon as the lockdown happened, they all had to flee the city because they didn't have any cushion, any support in which to survive in the city for a number of weeks with no income. And that sort of situation, we saw that this has replicated the disease in that country. And we've seen this situation so far also in, for example, in Uganda, where they had very, very strong lockdowns there. And people were not able to go out to work. In other situations where people have been able to go out to work, such as in Nairobi, in Kenya, people are also very, very impacted by being exposed constantly. So if you have to go out for daily work, you're being exposed. And in many cases also, a lot of people who work in informal employment have not been able to access employment. So poorer city dwellers are more likely to be cleaners, sanitation workers, more likely to have informal access to, informal work, which may have dried up during COVID-19. So they're in many ways much more exposed to the disease. And so we also see that the outbreak of COVID-19 and the need for people to isolate themselves has brought all kinds of problems. So, for example, a lot of places where I usually do work, such as Kampala in Uganda, Dar es Salaam in Tanzania, Dhaka in Bangladesh, we have people who are living, many people, usually it could be a family of 3, 6, or 9 people living in one room. And all of those people, they share a bathroom, they share a toilet with other families, they share showers with other families. And so these families are not really able to isolate themselves from other families. So this kind of situation makes the spread of COVID much more likely. And also even the information about how to protect yourself. So at the beginning of the lockdown, there's a lot of programs being done by partners that I've worked with in Sierra Leone, in Tanzania, for example, NGOs trying to work with local communities to spread the information about, just about basic, the need for basic hygiene, what COVID is, how it spreads, et cetera, especially for people who may be speaking different languages, who may not be from that region. So just this sort of basic information has been quite difficult to share. And I'm working with one of my partners in Tanzania on funding a small piece of work for them to work in Zanzibar, just to bring public information about the disease there, so that people can protect themselves. So this basic amount of information doesn't necessarily get through to people. And the other issue with informal settlements is that the cash-based economy means that people need money to access everything. So in urban areas, people don't usually have gardens for food, so they need cash for food, they need cash for water, money to use, you have to buy water, money to use toilets, anything for healthcare, electricity, everything is a cash-based economy. And so people do usually have savings, but enough for, maybe for a day or a week or a month, but this is depleted very quickly. And government handouts have come in some countries, have been less in other countries, especially for food. But I was just watching a video last night about in Nairobi, for example, people who are migrants or refugees who do not have identity cards are not able to access food aid, for example. And you have a lot of people living in informal settlements in Nairobi who may not have those kind of ID cards because they may be migrants or refugees. And so the situation of informal settlements where people don't have access to running water in their house, don't have access to their own bathrooms and toilets, probably don't have access to free medical care, and live in a situation of precarity in terms of informal employment, have been really severely affected by COVID-19. And I think just to sort of finish, I think that, addressing the 2 points that I've tried to make here, which is one is that COVID-19 is a zoonotic disease, and these kind of diseases are caused by human development and humans coming in contact with animals, and that this is and the loss of biodiversity in our planet. These are major issues that we need to tackle, and this disease is showing we need to tackle them now. And the main things of people living in informal settlements, of access to basic services and safe working conditions. These are problems that have persisted before, that the pandemic has certainly brought to the fore and made worse, and that addressing this universal access to basic services and infrastructure and safe working conditions is needed to both reduce the risk or the impacts of pandemics, as well as a host of other disasters and risks that we see in the future. So Farnaz, that's about what I have to say today.
Thank you very much, Cassidy. It was great. You mentioned very good points, actually, and I have one or two questions, maybe one, maybe two. So you mentioned very rightly that informal settlements, the quality of life, the quality of the built environment, which doesn't allow people to self-isolate, for example, access to basic services, which we all take it for granted in cities. So this is the situation in informal settlements. However, from an urban authority perspective, if they wanted to improve the situation, if they wanted to provide those services, they may think that, okay, if I do that, I will encourage the spread of more informal settlements. Because as we know, informal settlements are because the formal sector is unaffordable. because people are coming from rural areas to urban areas, from small towns to big cities for job opportunities. So if urban authority, municipalities think that improving the living situation in informal settlements is a threat, it will cause more informal settlements to emerge. Does it mean that we are stuck in kind of vicious circle?
So this is a sort of big question about informality and the sort of role of informality within the development of the city, and I think is a really good question. And from my perspective, the reason that in a city like Dar es Salaam in Tanzania, you have over 70% of the city is informal settlements. It's most of the city has been developed like that. And so you can't think that you can stop this development of informal settlements because it is the city. So working with that, I mean, this is obviously very resource poor context. So the financial obligations of having to retrospectively install infrastructure and services in all of these areas, even if they're co-produced with communities or other organizations, can be really expensive. So there is an aspect of the sort of that recognition becoming costly. So that could be an element of it. But I think that the view that by operating that way, it enables informal settlements to proliferate. Well, one aspect is to make available and provide land that is registered and formalized so people can settle on it. And we've had lots and lots of projects in the past that have done just that. It's that it doesn't meet the overall demand and the overall need. And until all of those, until informal settlements are properly serviced and there is infrastructure there, people will continue to live at risk.
Mm-hmm. Yes. And in between of your talks, you mentioned about NGOs, providing information to the population, to the residents of informal settlements. And I was thinking that if we see from one side we have city, we have formal city with administration, the normal life, which already is complex, already is a mega system. And then we have these informal settlements, the urban poor and this cash-based economy. And it seems to me that it is kind of parallel, parallel lives, parallel parallel cities, one formal, one informal. So, and we see that for NGOs are more active in those kind of informal settlements, whereas in the formal one, we have municipalities, we have organizations. So this division, can we see at some point that it's going to, to reduce? Can we see at some point that there will be a communication? That a university, when a university goes and works with an NGO to provide information, to help on the situation, whereas it should be the responsibility of, some other stakeholders. So what's your reflection on that?
I think that we see in some contexts, well, first of all, I think that in some countries, NGOs play a massive role in providing basic services, and certainly this is not a situation that a country would want to find itself in. You look at Bangladesh, for example, where it's NGOs that are providing massive amounts of education, water, social services, all kinds of things being provided outside of the government. And in one way, I guess this reflects on the lack of a government efficiency and accountability. But in another, and so it really reflects on this sort of failures of government. I think in Tanzania it's a little bit different, because the situation there is often that donors or large NGOs, or et cetera, will more work within the government system and help to bolster the way that help to bolster the services that government provides. And you see this across a lot of sectors in Tanzania. So for example, you do have in informal settlements, you do have local governments, and you do have this sort of a Mata office, for example, a local government office in a community. But NGOs will help to support with providing services within that local government, and assisting with that, because there's sort of a lack of services there. So it clearly points to deficiencies in local government, this need for NGOs to be involved, and also leads to this, what we call as co-production, which is where communities and NGOs and governments have to work together to produce services, such as, for example, water supply in a particular community won't be just something that's supplied by the water company, but might be something that's both provided by the water company in collaboration with an NGO like WaterAid, in collaboration with a community group that might actually run the stand pump and the management of that. So you end up with this co-production in which people who maybe don't have a lot of time are also involved in the production of the own services and infrastructure that they benefit from.
And I think that this co-production is a positive thing that brings top down and bottom up together at one point, and we might see it as a positive thing. And thank you, Cassidy. It's been a very interesting subject, and I know that there is plenty of room to discuss it further. And I hope that you will have time in future to come here again and talk for us.
Thank you. Thank you very much for inviting me. It's been a real pleasure. Thank you.